Hi friends, my name is Stephanie. Welcome to my channel. I'm reaching out to folks who are similar like me, who want to become a mother but are facing infertility issues. Know that you guys are not alone, and this platform is where I'm going to share my personal story, and I hope that you will be able to connect with me, get some insights. And if you're starting this new journey, or maybe you're starting this journey the first time, especially in Canada, it might be useful to you. I'm happy to connect and provide any information that I might have gone through. So my partner and I began our journey 3 years ago, in 2021. We've been trying for a year and we weren't successful. So we reached out to our family doctor, who referred to us to a fertility clinic. The fertility clinic that was closest to our place was Dr. Tanya Williams. She has been associated with Trio Clinic as well. So we went to her and she asked us to do a bunch of tests. These tests included vitamin D, AMH, as well as sonohysterogram. So vitamin D, for some reason, is connected to fertility. Don't ask me why, I don't know. Sonohysterogram is something which they do, which is cycle monitoring. By cycle monitoring, it's basically they ask you to come a specific day and time, so that they can check through ultrasound whether how many eggs you have in both fallopian tubes. So it's a way to understand how many eggs you have and whether your uterus is functioning properly, your fallopian tubes are open as well. So that is what the cycle monitoring process is about. And they basically take it out through blood, like they test your blood, and they do ultrasounds where it's needed. Mostly it's majority of the time it is the blood test. The AMH is to check your ovarian reserve. It stands for anti-Mullerian hormone. It is a test where they can evaluate whether you have enough eggs, and whether IVF or IUI is the best process for you. We were told by Dr. Tanya to start our multivitamins, so we would be optimal for whether we're doing IVF or IUI, so to speak. So that was what we did. The result of the test was, or the diagnosis that Dr. Tanya provided us was, we should go for IVF directly. Dr. Tanya is really professional. She has good site manners. So she told us that we should go for IVF because I have low AMH reserve. And then she also recommended that we would be taking our drug, which has a side effect, and that would include, I don't remember what the drug was, but it would include some hair growth, and I don't remember what other side effects were there, but hearing from her that I had to take that drug, as well as how she asked us to do IVF directly because of my low AMH, didn't really convince me and my partner, so we didn't go ahead with it. I actually asked my family doctor to help me look for another fertility clinic, because I wasn't really confident about going forward with Dr. Tanya Williams. If you're new to Canada, you should probably know that you need to book 3 months, for to get a fertility clinic appointment. It takes 3 months. And if it's a good gynae, it's gonna be easily 6 months. So your family planning could be delayed because of that delay. So our next step was to find the next fertility doctor, and what we told Dr. Tanya was to please put us in line for the government funding. So she did that for us, and I did my research and I found out that Markham Fertility Hospital is pretty good. So I joined the Facebook group. I think it's called MFSC Girls. and I asked around to see if there were anybody who could refer a good doctor. So I found Dr. Crystal Chan, and one of my Facebook friends told me that she had a good experience and she's really nice. So I asked my family doctor to refer me to her. Again, my 3 months clock started again, and so we just kept trying at home while we were waiting for this whole process. And then we had a meeting with Dr. Crystal Chan. She was, and I think we had it in our, not physically, we had to do it virtually. So she asked, we forwarded our reports from to our family doctor. So she reviewed all of it, and she said that we should go for IVF as well. But the grounding or the reasoning that she gave was quite solid. What I like about Dr. Chan was that she spoke from experience. So I wasn't really unsure about it because she sounded like she knew what she was doing. From the tests that we had previously from Dr. Tanya Williams, as well as when we were doing in 2021, we also did a test with a urologist, and we found that there are some male factors involved that we need to consider. Therefore, Dr. Chan told us that we should go for IVF because it, instead of doing IUI and waiting and wasting time, especially with my low AMH, I shouldn't be wasting time, and it would be best for me to go ahead and do IVF directly. If it doesn't work, I still have the option of IUI. And then she also mentioned that we should do ICSI, because ICSI, I wouldn't get to the medical abbreviation of it, but basically ICSI is a procedure where they take the sperm and they put it in the egg directly. So it's not left in the petri dish with the eggs. It's actually inserted into the egg itself to create the embryo. So ICSI does that. So Dr. Chan was pretty advanced in her, like she already knew what we were going to ask, so she was really prepared for it, like for the questions that we had, and she was very good at guiding us, like what the drugs would be and what the side effects would be and how normal it is and how much risk there is. So she told us like we don't need to worry too much about the drug part. And it is a common practice to have those drugs. She has administered it to many patients. So that's why we went with, we were quite comfortable with taking her advice for IVF. So we decided to go, and we were scheduled to do it, I believe, in August. I'll get to the dates in a bit. So if you are interested to know about the multivitamins that are needed in order to, help with your fertility, I will list it down and I will show it to you in my next video. So please stay tuned for that. And I will share more information regarding what happened with Dr. Chan in a bit.